Hi, Craig here with Professor Medicare. And as we get ready for annual enrollment, it starts on October 15th. And that's the time when, if you have a standalone drug plan, you can change. You can also change Medicare Advantage plans. This is primarily focused on our members who have Medicare supplements and a standalone drug plan. And we anticipate changes this year. We won't know till October. What's happening is when they passed the Inflation Reduction Act, and it started in 2025, that means if your out of pocket drug cost reached $2,000, after that, you pay zero for your medications. Next year, that number goes up to 2,100. So, what does this mean? It means that the carrier, your drug plan, has to pay 60% or more of the cost after you hit $2,000. The balance is picked up by the manufacturer and Medicare. So we could see premiums go up. We can see coverages change. We just don't know yet. So I want to get you ready for that. And I'm going to show you a way that you can keep a record of your medications. You can make changes there. You can see what your ongoing costs are. This is really important. And it's quite a simple process. I'm going to walk you through it in the following video. But remember this, that once you create an account for yourself, it's really easy to go in there and drop meds or add meds and figure out your yearly cost and monthly cost. We're doing this in September. So what it's going to do is give us the cost from October 1 through the end of the year. Now, once we're in annual enrollment, it will give you the cost for the entire year of 2026. Just keep that in mind. So we're dealing with basically a 3-month time frame for cost. Okay? So let's get going. So first we'll go to medicare.gov. Welcome to Medicare. Get started with Medicare. Now what we're going to do is look at these two choices on the left. Log in or create an account, find health and drug plans. Now going forward, I suggest that you log in and create your own account. You can store your medications there. You can keep up with the cost monthly and yearly. It's really a handy thing to have. Since we're not logging in for an individual right now, I'm going to do this anonymously. Let's go find health and drug plans. We don't have to put any names in. So we're going to find plans now. First, they want a zip code. Let's use 80304. Now, this is specifically for people who have a Medicare supplement and a standalone drug plan. So I'm going to click Medicare Drug Plan Part D and then find plans. It's going to ask if you get help with your Medicare health or drug cost, Medicaid, supplemental security income, Medicare savings, extra help. If you don't, click this circle and move on. Do you want to see your drug cost? Absolutely, yes. All right, let's get going. So we're going to put in 3 drugs to make it easy. Let's start with a couple of generics. Losartan, that's for high blood pressure. Click Losartan. It's going to come up with a variety of tablets. You've got 25 meg, 50 meg, 100. Let's choose 50. Most people take one a day, so let's put 30 every month in there, okay? Next, let's put atorvastatin. This is for cholesterol. Atorvastatin, and the choices are 40, 10, 20, 80. Let's use 40. Once a day, 30 every month, add to drug list. Now, what we're going to do is I'm going to put in Synthroid, which is a brand name for thyroid issues, okay? Synthroid. And when I put it in, it says it comes in a generic version called levothyroxine sodium that may cost less. Would you like to add levothyroxine to your drug list? Well, right now, let's keep the brand because I want to show you the difference in cost, okay? So it comes in tablets, 88, 100. Let's put 112 mcg once a day, every month, add to list. So with those 3 meds, we're going to say done adding drugs, and now we'll put our pharmacies in. So let's start with Safeway. Scroll down, Safeway, click mail order. We want to see what that is too. Let's put in King Soopers, find pharmacies, and then one more. How about Boulder Medical? Find pharmacies, Boulder Medical Center. So we have four. You're allowed five. We'll use those four. Now we're going to look at the plans. We're going to see what the costs are. Now it's going to compute these costs from October through the end of the year. Now, if you do this during annual enrollment in October, it's going to give you the cost for 2026. But for right now, if you're not in annual enrollment, it gives you the cost from the next month to the end of the year. So we're going to get 3 months here. So with WellCare, they came up lowest. It's a zero premium, and their retail pharmacy's 142, mail order 136. Now let's look at the cost. We can drill down, view drugs and their cost. So it will bring up the WellCare value script. That's what we clicked. And it shows us here the retail pharmacy. Now, keep in mind, this is October to the end of the year, is 142.05, and mail orders 136.80. Scroll down, and it will break this out and give you the monthly cost. So King Soopers is preferred, Boulder Medical is in network, but not preferred, Safeway is preferred, and mail orders preferred. You're going to get the lowest cost with preferred, but I wanted to show you the difference. So with King Soopers, you see atorvastatin 0, losartan 0. Look over here at Boulder Medical, it's $22.35 for each one. Synthroid is $153. Here it's only $138. But look at the monthly cost, $153, $183, $142, $136.80. So it's good to know because you may be using a pharmacy that costs more than one of the others. So this will help you, this will alert you to that fact so you can make a change if you need to. And then down here, here's your monthly cost. This is a nice breakout. If you do mail order, that's usually for 3 months, it's $136.80. And the others, you see here, Safeway comes up lowest at $47.35 a month. All right? Now that's for WellCare. Now, if we want to go back and look at another plan, go back to search results. Let's say that you have a Cigna plan. It's $184.05. WellCare was $142. WellCare Classic, $203. It's because it's got that premium every month. Humana Basic, $206. See how it goes up? You want to pay attention to that. That's really important. Now, we talked earlier about how we put in Synthroid instead of the generic. Now let's change it. We're going to remove Synthroid, and we're going to put in levothyroxine. I want to show you the difference. Levothyroxine sodium, add drug, 50 mcg. I think we had 112 mcg. Now here, most people take tablets. If you hit capsule, it's going to be a heck of a lot more, so be careful. The tablet is usually what's prescribed for that. Once a day, every month. Okay, add to my drug list. We're done adding drugs. We're going to use the same pharmacies. Now let's look at our cost. Oh, look, WellCare 0. If you use the generic instead of Synthroid, it drops it to 0. Cigna, $11.70. Part of that is that monthly premium. Because this cost right here, it gives you the drug and premium cost, okay? With WellCare, since there's no premium, it's 0. And if you go down, you can see it can go up. Let's say you have a Humana plan. Well, let's see what Humana is. Go to insurance carriers, click Humana and apply. And their lowest cost plan is $95.67, $60.56 mail order. Now here's what can happen in 2026. This premium may go up. We don't know. It may go up to $90 a month. It may drop. I doubt if it's going to drop, but you got to pay attention to that because it can really change for next year. So that's how you do it. That's how you look up medications. And once you have your meds in here and stored, it makes it really, really easy to see what your costs are going to be ongoing. All right, I'll leave you with that. Again, Craig with Professor Medicare. If you need help, give us a call. We're always glad to help. Bye for now.